We are live. Welcome,
We
everybody,
are
to the Poly
live
Pimps show with Me Too and Sky.
in the house, in the building.
Everyone.
And tonight we have two wonderful guests with us. We have Masanya
Hey y'all.
and Dr. Travis.
Thank you. Professionals in
Hi.
the building.
Welcome to the Poly
We,
Pimp
yeah,
podcast.
we need professional help over here.
Yes.
Okay.
Professional. I love that.
Professionals. We need
Yes.
professionals.
So, how are you guys doing? How's your week been? I feel like it should be the end of the week, but I realize it's only Tuesday.
Right. Well, how was yours, Travis?
Oh, rolling in the deep.
Facts.
Ooh.
Right. Right. I'm exhausted. I'm like being propped up right now. Today was
Mhm.
wild. But
So,
tomorrow
for
we work
folks,
together, so it should be fun.
cool.
That's
Travis.
awesome.
So, for folks who don't know, they have just tuned in to the Poly Pimp podcast. I am Sky, my cohort this way.
Me
This way
too.
is Me Too. And we are promoting and educating about a polyamorous love style for folks out there who know that pimping ain't easy. And we like to get like these professionals in here who can help us navigate. Folks out here are having multiple partners, and we want people to be protected and mindful of proper sexual health. And
Aware.
so, yeah, so let's get into it. Let's get some intros.
Girl.
All
Let's
right.
start with Lasagna since you've already been here before,
I
but you do an
know.
intro and then you introduce Dr. Travis.
I
Let's make it
absolutely will.
okay.
Guys, I am back for season 2. Yay, I'm excited.
Yay.
So I have been practicing nursing for about 14 years now. And about 2 years ago, I decided to transition from psych. At least I didn't know I was transitioning from psych, and fell upon the specialty of infectious diseases, sexual health, which I have fallen in love with, and now I'm finding it hard to leave it. So in that time, I got to meet Dr. Travis, and we work together, and we are educating the masses on so many different topics. So, Travis, would you care to enlighten the people on who you are and what you do?
Quick, okay, great. All right, so my name is Dr. Travis Walker. I'm a family nurse practitioner. I'm doctorally prepared, and I've been working in the HIV, sexual health, sexual awareness environment for probably about 8-9 years. Probably seen thousands of people at this point. And my goals are to help guide and navigate. That's all I do. I guide and navigate. I never demand.
Okay.
All right. I like that.
Okay. So with all these thousands of people that you have come across, how many have openly admitted that they were in a polyamorous, multi-partner type-esque open relationship of that sort? What's the approximate percentage?
I'm gonna say they maybe about 5 or so percent, maybe about 5 or so percent have talked about it with me and let me know they're in a situation where there are multiple partnerships going on. And so, and I find often in my setting and my demeanor, patients will tell me anything I need to know so that their sexual health can be secured.
Mhm.
So then, would you say that with that experience, that most of the people that come to you, for diagnosis, treatments, and all that, are monogamous? You would assume.
They are living in the monogamous space. They may not be actual monogamous, but they're living in the monogamous space.
Correct. Okay.
So 5% are willing to openly communicate their reality, and probably a good chunk of the 95% are also engaging in multiple partnerships, but they're just not really open about that conversation.
I don't know if it's open with a conversation with me. What their setting may be is that they are with a main person, and then there's extra folks on the side, but the main person is not supposed to know about that.
Right.
Gotcha.
That's true. Mm-hmm.
That's the difference between ethical and unethical non-monogamy. That's what, in essence, that's in essence. So, yeah. Alanya is in the building. Hi, Mom. Hi, Travis.
Ah,
Yeah.
That is
hope
funny.
you're not watching as well. I love that.
Oh yeah,
Okay.
absolutely.
So I have questions. I don't know if I should go first though. Me too. Do you want to hit it?
Oh no, you can go.
Okay.
I'm
So
on fire tonight.
I guess I'll start with like keeping it easy. What is your approach for if someone comes into your office and says, I want to protect myself from various diseases and what have you? What is your approach on how do you communicate? Like, what are you saying to them in terms of, I have multiple partners. What's the best case scenario? What should I do?
You want to go first?
This
Travis,
question's
or you
for
want
me?
to go first?
Either or, both.
Oh, okay. Well,
I'll
I
go.
guess I'll go first.
I'll go first
You
and
want to
go
go first? Okay, you
outrageous.
go first, and then I'll go on after.
My answer to if it's around sexual health, and my answer to that question is stop having sex. I'm kidding. Continue having sex, but
Find the Lord. Is that what you're trying to say?
Find the Lord. So funny.
Did he just
Oh,
get
I think
stuck
he
right there in that
froze.
position?
I think you froze, Travis.
What a position
Travis
to be frozen into.
It's Mercury retrograde, guys. That's why.
I know, right?
That. All right. Well,
Okay,
I try to
keep
educate
that
them
was
on
the
the fact that if
longest
they're an HIV
laugh.
negative person and we can get them. My final takeaway would be if you know that, let's make a name up, Jane is a little sketchy, perhaps Jane needs a condom, but maybe Mary is a little bit safer. I'll think twice if I'm going to use a condom with Mary. I still bring in condom conversations often because it's the one thing that could save you from having syphilis and having to get syphilis treatment or having HIV. So it's still a conversation for me to have with people. Do people use condoms? Not really, but it's in the back of their mind, and I surely will share them out, condoms out, and lubrication and whatever you may need. Even educate you on how to put it on if you haven't done it in 100 years. That's okay too.
Absolutely.
Okay.
What about you, Miss Tanya?
I am always I always take a pro, I guess you could say I'm pro positive sex. So I always tell people if you're here, that means you're aware of sexual health. And part of being sex positive is knowing that if I am having sex, I need to also be tested regularly. So that's the approach I usually take with them. If you are human and breathing, eating food and living, you need to be in some form of self-care or medical care, period. And it's the same thing with sex. So if you're thinking every day, I would think you need to be in some type of mental health therapy as well. So I try to normalize sex and let them, especially if they're coming to me with an STD, let them know that this is a part of being sex positive, especially if you have multiple partners. It's not the end of the world if you have an STD. We can treat it, we can move on, but it's a part of caring for oneself. If you eat burgers every day, you're going to have high cholesterol. If you're having sex with multiple people and not protecting yourself, you're going to possibly contract something. Yep.
Correct. I agree.
So, what are people contracting more?
Easy question. Syphilis.
Really?
The rate of syphilis has significantly increased. And a part of me blames this mildly, and I don't want to blame it, but I want to displace it to the fact of PrEP medication, PEP medication, post-exposure, and even birth control methods.
Okay. So explain that. So go ahead.
people
So
are
are
no
you saying
longer
that people are not using protection because they're using
Right.
these other things,
Absolutely.
basically? Okay.
I can stop a baby and I can stop HIV. So syphilis can be treated, gonorrhea can
Right.
be treated, chlamydia can
Right.
be
Right.
treated. So those are okay. But since I can stop these other things, I don't really focus on using condoms or trying to say again, we're using the name Jane or Mary. Mary's a little sketchy, and I know I should do something, but I have something that I can do if I go and have sex with this person. I can still go to the clinic, get tested, and maybe even get treated.
Absolutely.
I
Yes.
totally agree with Travis because um, when I talk to especially women, um, and I'm talking like monogamous people because that's the group of people that I'm talking to about those things. Usually, when they're like, "Oh yeah, me and my boyfriend, blah blah blah, I'm gonna go, I'm on birth control," and that's usually because even before they become like an item. Sometimes people choose to have unprotected sex, right? And when I ask, okay, so are you using protection? And they're like, well, I'm on birth control. So to most people, the protection part is really just against pregnancy. They don't think
Mm.
about um, anything that could happen beyond pregnancy. So I totally get it. And just like Travis said, as a lot of this stuff you can just get a shot or some pills or whatever, you can get treated and you'll be all right. So most people are not scared of it, but they're afraid of HIV. So most of the time, if they're on PrEP, I could see why they would feel like, well, I'm doing something for the for the bigger beast, so I don't really have to worry about the rest of it.
Right.
Yeah.
So what about oral sex? What is the best case scenario? I mean, I've I've heard that what is that guard thing that people
Oh, the
do?
dental dam.
Mouth
Is
guard.
that, I
Mhm.
mean,
Like,
actually, before I even asked about that,
hmm
are you supposed to be having are you supposed to be having oral sex with condoms on? I mean, is that what people do, or is it like, yeah, that I just sound like I don't know what I'm talking about, but that's really what I'm trying to understand.
I think that for oral sex category, a lot of people are not going to have oral sex with condoms. So the best we can do is get you tested to see if you have either gonorrhea or chlamydia, checking to see if you got gonorrhea and chlamydia. I like to tell this audience right now, and if you don't know, you can get syphilis from oral sex. So a lot of folks are focused on gonorrhea and chlamydia because we're aware that that can happen in my mouth, right? Yeah, maybe. Oh no, syphilis too. You can get that as well.
Hmm.
Very interesting. That's good information to put out there
So
for
Yeah.
sure.
essentially, you should use.
So how do you be safe with oral?
Oh, that's a tricky one.
Because I mean, you can use the things, but will people
Is
actually
it
use the
is
things?
it like the whole saran wrap thing?
You could attempt that, but your semen can permeate through that, so it doesn't really it won't save you per se. There are condoms if you want to have safety around oral sex. You can use a condom. There are condoms you can use for oral sex purposes. There are flavored condoms, so you can at least get a different taste and texture from it. But the best option is either condom or don't do it. But we know we're doing it, so
We
So
know
that
we're
whole
gonna do it.
the whole dental dam thing is not a thing?
it's not a thing.
It's not a thing.
No.
Oh,
I've never even seen one. I know we've talked
Seen
about
I
them.
it,
have
and we
seen
talked
one,
about
but
it the
I've
last
seen
time.
them,
I've never
but
but
seen
people
it.
are not
I thought
using
it was a
them.
thing. Oh, they're not using them.
They're not using them.
I mean, I honestly, I'm trying to like picture how that's gonna go down with it.
I'm not even gonna waste my time imagining.
Listen,
I'm not using it.
I'm not,
I'm one of those people.
like, I can't even imagine how it's gonna happen with
Right.
something around it, you know? So Yeah.
That is
What
hilarious.
do we
But they
do about
sell them
that
on
then?
Amazon for folks who are interested.
Right. They are on Amazon.
They're like by the 12 pack.
So what do we do about that?
Be
What
sex
Don't
part?
do it.
positive.
He said don't. The doctor said don't do it.
Oh
Don't
yes,
do
But
it.
also,
Stay celibate.
don't do it.
let's bring
Don't.
perspective though. I've met a couple of people in my life and people in
Mhm.
my patient life who they saw that there was a rash, irritation
Mhm.
on John's penis. But I
Oh
still did it.
no.
But I still did it. They saw it
They
was
saw
fully
it.
erect. I'm gonna talk now. They saw it was fully erect and it was oozing, and I wasn't sure what that ooze was.
Right.
But I still did it because I
You
needed to
felt
calm
the
Gross.
William
pleasure.
down.
Gross.
They didn't feel like
That
they
is
could back out of it, huh?
disgusting.
You came over for this late night oral sex activity. I'm
Exactly.
expecting an outcome.
Right.
Yikes.
Yep.
Trash.
Emphasis on the come.
So, and then you get the urgent visit where he's like,
You
"Hey, I
mean
had
it
a
was
night."
green and had moss growing and there
Oh
was
my God.
still jumping on that? I'm just,
because
It happened.
and then sometimes John
it
may
was
have weaved us,
inflamed red and spitting fire.
Right. Right.
but sometimes John may have weaved a story like, "Oh, I don't know what's wrong. All is good. It's just you. It's just you. I'm
Right.
only with you. Come on, you know me. You know
That
me."
is a mess. That's
Mhm.
unfortunate. That's
It's true.
unfortunate.
And that's okay. I still see them all the same, and I will see them, and I will make sure they get the care they need to if this has happened to them. You can
Absolutely.
even in the sexual health arena too. When it comes to medical professionals, we will sometimes, based off of your history telling, how your story may have navigated, we'll treat you before we even know the illness is there. Based if you have symptomatic reasons, if one of your partners have told you, "Hey, I have gonorrhea, chlamydia, syphilis, whatever it may be," we will make a decision with you, a patient, or make a decision with a patient and say, "Hey, we have the option to do a treatment today and test you, or your option is to wait and then be treated is okay too."
Right.
Okay.
How long does the treatments usually take?
Depends. So for syphilis, the treatment can be anywhere between 1 to 3 injections, or it can be oral medication for 14 days minimum. And then for gonorrhea, it is a one-time injection, no sex for 7 days, or you can pass still gonorrhea to another person. For chlamydia, it's a 7-day regimen where you take medication orally for 7 days.
So with that, I wonder if our audience, if the people watching, listening, are gonna think like, what do you want to choose after this information? Do you want to choose to keep having sex or having to stop any activities until things go away? And even with that, if you
Mm.
disclose it, like, do you think
Right.
like people will be comfortable sleeping with you?
I also, I on what you're saying, I do think that is a big reason why one sexual partner makes a lot of sense to a lot of people, because all those factors and numbers start adding up and it gets a little janky. You know what I mean? I
Yeah.
mean, this is a poly podcast, but like, let's be real. I mean, if folks aren't really being transparent about how they communicate and who they're involved with and what they're doing in terms of like fluid bonding and this and that, then it becomes a scary road to be on,
Right.
you know?
I
Well,
push honesty. I mean,
yes.
people are not necessarily going to follow that. And then
People
with
be honest and lying at the same time, you know what I mean? They'd be like,
that,
honey, this is what it is, and it's already all the way not what it is. You know what I mean? So, that's the part that gets kind of scary. So, as a poly person or openly, or even if you're single and dating multiple people, it's all under the same boat. There's multiple people involved. And once that one person meets up with the wrong person,
that's
the
it.
whole crew, everybody,
Yep.
yeah, no, that's not cool.
I also think that we need when I say we as a society, we need to start educating, even if you are to, in a monogamous situation, right?
Mhm.
If your boyfriend, girlfriend say they're only with you, I feel like we need to really educate people in getting tested before you get into an encounter with that person, because most of the time, like we've talked about that before, most monogamous people, I don't want to say all, but most monogamous people never get tested. I know I was one of those people. It's like, oh, we go together, you're my boyfriend, you're my girlfriend, okay, it's okay, we can have unprotected sex without even getting tested. We don't really, because a lot of people get offended if their partner were to ask them in monogamy, if their partner were to ask them, hey, can we go get tested? Automatically they feel offended. It's kind of like, oh, are you saying I have something? They don't see it as, you know what, I'm also trying to protect you because you don't know that I have something or not. So we need to protect each other. So if we're saying we're gonna be with each other exclusively, let's take the step to know what we are bringing to the table and what we're not. That way there's no blame game going around if something were to ever happen, or exactly what you brought to the table. So if
Right.
something does happen, you're like, well, you got some
Mhm.
explaining to do, you
Mhm.
know? So I think we need to do a better job at educating
Mhm.
monogamous people before they get into the
Absolutely.
monogamous relationship to get tested on both sides.
I agree. I believe
Yeah.
that in monogamy, there's a lot of hidden polyamory. So that's the part, that's the issue.
We rather call it hidden non-monogamy because
Hidden
polyamory in
monogamy.
essence means it's ethical.
True.
But yes, that part. Yeah,
Hmm.
that part. I
I
mean,
will.
go ahead.
I will add to that for all monogamous married people, man with woman, woman with man with man, doesn't matter to me.
Right.
I often, if you're my patient, I often will say to you, let's just check once a year. And it
Exactly.
goes with your annual physical. I'm
Hmm.
not saying nothing is happening. I'm just saying let's just check once a year
Yeah.
That's the least you can do.
at minimum.
Exactly.
Yeah.
Hmm. That's
Yeah.
true.
I know a couple that it was a doctor and his wife was a nurse, and she was watching people with AIDS and all these types of mostly AIDS. And she told her husband, she got some condoms from work, and she tried to persuade her husband to use condoms. And he was like, absolutely not. We're married. And she ended up she ended up getting HIV from him. And I guess she suspected something or what have you. But yeah, um that she had initially been saying let's do the whole condom thing, and he was like, no, we're married. And yeah, it was
That
kind of
was a
sad.
way for him to hide what he was doing.
Yeah, and she probably kind of either knew or kind of subliminally, like she knew for real or she kind of felt it.
Right.
So Jaquan said
Mhm.
some people rather tell half truths because their full truth is something they might not be ready for.
That's true. Hey, Jaquan.
Hey.
The fact.
So
So
what do you recommend for somebody who may suspect that they have HIV? Let's start with that.
I say get tested immediately. I mean, honestly, if it's something you have at that point, there's ways to basically get treated and receive some level of care. um, I think it also depends on where you go to. You want compassionate medical professionals, and sometimes I get reports that like patients will come from like other places and let me know that, oh well, I went to this clinic and they were just so brash and so harsh. So I think it's really important that, yes, go get tested, but also go to a place where you feel like you're not being like accosted for ending up with HIV. That's really important.
What are the
So,
first signs for somebody like that is newly infected? What would be the first signs that they would notice?
that's a good one.
Fever. It'll be maybe a fever or flu-like symptoms, body ache. Maybe their lymph nodes in their neck all of a sudden is swollen and sore, and they're like, I don't know why this is happening.
Right.
Super fatigued. They're like, wait a minute, this is not my typical day. I feel absolutely not myself. What is happening? But it goes on for days, never recovering, never getting better. The lymph nodes in your neck may get larger. That flu-like, fever-like feeling may come even longer. And you're like, what is this? Do I have the flu? Most of the time when someone tells me they have a flu, my as a clinician, first thoughts are, let me get that sexual history, because maybe that sexual history is going to tell me I need to do an HIV check as well.
That is very interesting.
Yeah, that's
I
good.
just,
That's good to know.
yeah,
Are,
I never knew that.
where are you guys both? Like if you want to share like either the clinics or the areas or whatever that you both are supporting.
So I'll say area for me, which is Jamaica, Queens, but I also will say that I've launched a telehealth practice for this whole purpose with some of my other colleagues. And we really focus on all of New York State. So you can see, if you're in New York State, you can see somebody in Simple Healthcare.
Right.
Okay.
Yep. And I'm in Jamaica, Queens. I feel like everyone knows where I work, kind of, but Jamaica, Queens is where I am, and everyone that has my information, they know how to reach me. I am on Instagram at the Divine Comfy Couch, and everyone has my number. I'm pretty sure. Hit me up.
You want to give it out, or is that just when you say everyone, you mean those
everyone
people?
has my main number, but I do have a number that people could contact me at for real.
And is it what? Is it for like a hotline? Like I need to talk to you about something sexual?
Like literally, it's best text message, because I'm an old lady and I'm of a certain age now that I'm a grandmother. So bedtime is like 9:30. But
Right.
if people really wanted to get information for real about HIV or where they should go for care, and if they actually want care from myself and my team, they can reach me at 646-820-0716. That's
0716.
Yep.
646-820-0716.
Absolutely. And I absolutely will text back, because I'm here for y'all.
Wow.
Okay. So I want to get a walk through, I guess, for our audience of first symptoms for each of the known or most popular STIs. So we got it for HIV. You said flu-like symptoms, fever, fatigue, and all that. So what is next in line? Oh, you said syphilis is one of the most popular ones.
Sure.
Let's start with that.
A syphilis top symptom that you may see is, again, you might have some type of not feeling like yourself, a body rash that sometimes become very fine, but then very unusual to you. A body rash, it could be on your chest, on your back, it could be on your hands, it could be on the sole of your feet. And then for a really defined symptom, which usually comes pretty early on as well, which is a canker sore, or a sore that's on either the genital area. It could be for women, it could be on the labia, or it could be on a man's head of the penis. It could be on his scrotum. It could be on the shaft of the penis. It's a round-like circle that has a bit of an indentation in the middle of it. And it's a clear, like, this is like clinically finding, I got syphilis. It does not hurt. When you touch it, you're like, this is so painless, but I can see this sore here, but it's painless. You can assume that maybe I should get checked for syphilis.
Okay.
Yikes.
I'm not going to remember all that. I mean,
I got it. Painless sore.
Oh, you'll know. You will know. Because
let
me tell you,
I mean, I don't plan on having anything, but
we're sore. All right. What about gonorrhea?
Gonorrhea's top symptom is I have a little bit of a burn. I have a bit of a green yellow discharge. Is the first symptoms of gonorrhea. Green yellow discharge. For men, testes or in the scrotum area may have pain or discomfort. And for women, the vaginal area may feel sore. Or you may feel like my abdomen, my lower abdomen area doesn't feel like itself anymore. What's going on here? But that discharge comes up pretty quickly. So you'll see that discharge, that green yellow discharge fairly early.
Okay.
Yikes.
What's next? What's next on the list?
Chlamydia.
Chlamydia.
Yes.
For the genital area, again, this is more of a clear yellow, not clear, I want to say clear, like a yellow, whitish type of discharge. And you have itching and pain with urination fairly early on, maybe after 1, 2, 3 days of contact. You'll have this discomfort in the area. Again, maybe testes might feel sore. And again, for women, abdomen area feel very sore and tender below. I know I talked about gonorrhea and chlamydia in the genital area, but we'll also talk about in the rectal area. In the rectal area, it could be for chlamydia, either one, chlamydia and gonorrhea. It kind of shows similar symptoms, which is maybe a mild discharge or feeling uncomfortable when you make a bowel movement. And again, gonorrhea and chlamydia of the mouth, if you have it there, you might have a sore throat. You might feel like, is this like a flu or a fever type of deal happening in my throat? It feels very specific to the throat. And if it carries on, it can become, just so you know, like perhaps a little bit of a pneumonia if it carries on for too long.
Are any of these? Go ahead.
No, I was gonna say now anybody with a sore throat is gonna feel like, do I have gonorrhea?
Well, are you using that part? First question.
Like everybody's gonna feel like a suspect right now.
Dentaldam.com. Are any of these my thought just came and went. It'll be back. It'll be back. So you just mentioned 3. You also earlier mentioned HIV. There's more though. There's more STDs, right?
There are. We have the herpes. Also for sexually behavior, you can get hepatitis B, you can get hepatitis C. Those are the main takeaways.
So what is the difference between B and C?
Just how the virus conceptualized how the virus performs in your liver. Hepatitis B has, just for clarification for this audience, hepatitis B does have a vaccination. So if you're hepatitis B negative, you could get vaccinated from hepatitis B and not worry about it any longer. Hepatitis C does not have a vaccination, but it does have a treatment. So if you get hepatitis C, you can get treated for it. And again, it's both hepatitis B and C, how it performs in the liver, what it does to the liver, and how it needs to be screened further on. Both of them are toxic to the liver. They cause problems with the liver becoming too hard, unable to perform. The main focus of the liver is to get rid of toxins. It can't do that when hepatitis B and C is on board. And as for B, if it's not suppressed, we try our best to suppress it with medication. And for C, you can get treated for it.
How about hepatitis A, right? There is A.
There is A, but the main goal or the main way of getting A is if someone gave some form of fecal matter to you, so stool matter from either cleaning something, cooking food for you, or a food or water source has it in it, and that's how you can get hepatitis A. It's not really from the sexual category, if you will. Okay. Could be if you're eating, we know what. Could be.
Hey, people have all kinds of.
You're eating doo-doo.
I'm done.
Not like that. You're just gonna put that out there like that.
You took it there.
I know it's a thing. It's a thing. People do that.
Oh yeah,
people have all kinds of.
Right.
People do that. It's a thing.
It's a thing, and hepatitis B will be a thing too.
Absolutely.
Yeah.
Yep.
Okay.
I mean, it's not funny, but it's real. It's real.
It's good to know. Good to have clarification because I always felt like all 3 of them were sexual infections.
Really, of B and C is the ones that are really from sexual activity.
Okay.
Other ways too, I like to share when we're talking about hepatitis B and C. Other ways you can get hepatitis C is from drug use, and the drug use can be injection drug use, or it can even be if you're using some type of device to bring drugs into your nose. That device, if you share it with someone else, it could have your blood sample on it, or a person who has hepatitis C blood sample, and they basically brought the blood sample into their very vascular area of their nose. And that's how you can get hepatitis C as well.
Okay.
Very interesting.
Don't share your needles. Don't share your drug
Exactly.
So what
thingies.
are I mean, I guess this is going to probably be related to New York or maybe even Queens or what have you. But what kind of numbers are we looking at here in terms of like people who are like, I'm sure it's only the folks who come to see you guys, but isn't there statistics? Like, what are the numbers of population versus how many people are getting these STDs? Like, what is that? What's going on in your area?
I'll give it to you a little simplistic only because I looked at them mildly the other day. So I don't have like true numbers, but I'll give you significant numbers. There's a significant number of Black women who are getting HIV and syphilis. There's a significant amount of women in general who are getting HIV and syphilis. The LGBT category has almost, I don't want to say stabilized, but their increase is not expected, but it's a constant increase, if you will, compared to those who are Black women and women in general getting HIV and syphilis. Their rate has increased significantly.
What would you say has contributed to the increase in Black women and women in general in getting HIV? Have they speculated on
I don't
that?
want to get yelled at by the people.
I was gonna say, if I say it, I'm gonna get.
I want to know. I want to know.
Well, we're here to educate the people, right? If some people are acting in such manners, so they know.
Right? Travis and I are like,
uh-oh.
I'll say it in a softer way. The gentlemen,
because I don't have grace right now.
The gentlemen are gentlemen out there. And not only are some having sexual activities with women, but they're also having sexual activities with men, not sharing it freely.
Oh, no.
And they're also having sexual activities with sex workers and not sharing it freely. There is a significant probably amount of those categories where they still have wives or they still have a partnership with a woman, especially Black women, and they are putting them at risk by not sharing that. Hey, I think it would be easier if you just say, hey, I want to have extra sex partners, but that's my mindset. But that's not what's happening. They're like, you're the only one. I love you.
With that voice too.
Well, you know, that's why we're trying to that's why we're trying to like tell people that we get you, like we get that sex is a thing and we get that it's natural, but we also don't get this secret society sex life thing, and we want folks to just be straight up, you know what I mean? Like just get the communication right, you know? But it's a mountain to climb, that for sure.
I'm going to add to that and say, women of the audience, if your spidey sense goes off and you're like, I don't believe Craig is doing what he says he's doing, go with it.
Yeah.
Craig
so many times without, yes.
Yeah.
I mean, so many times without our intuitions, but I swear it's always right. It's always right, because we always go back, man, I knew it, but I didn't listen.
Yeah.
You know?
All the time.
Usually the feeling comes over. I've had patients, I've been in most of the boroughs of Brooklyn and Queens and sometimes Long Island. And I've run across women who got an STI or sexually transmitted infection or maybe even HIV. And they were like, I had a feeling way too often that I hear that. And I say to myself, if you had a feeling, you should protect you first because you love you first. Right. And gentlemen is second. And if your spidey sense told you, you go with it. Believe it.
Listen to it.
Yeah, I like that. That's good information. What were you going to say, Mufanya?
Situations. Well, multiple women have come to me and said, even gentlemen, now that I think about it, have come to me and said, Well, the person I was dating always had to take their vitamins. And they'd be taking their vitamins, and I didn't think anything of it. And one day happened to check out said vitamins. And that was how they found out that their partner had something, some either HIV, an STD, and that's how they found out. And then eventually they get themselves tested and find out that they also have it. So
No
it's really
way.
important to pay attention to intuition. I don't know about y'all, but I am a nosy gal. And any person that I have ever been with, I am in your medicine cabinet. I don't care who you are. That's just me. I want to see what's in there and I need to know. So I think people need to be a little bit more nosy. I mean, if you got money like that, hire a private eye. Why not? Just to find
Yeah.
out what's going on. Yep.
I don't think I've ever
Nosy.
really
I'm a Scorpio,
gone.
but this is what we do. Investigate all day.
I don't think I've ever
Wow.
really gone into somebody's like as far
Hmm.
as asking for medications and things
Yeah,
like that. I've never asked. The only thing I've asked is like testing. Now I'm gonna add that to my list of asks.
absolutely, girl. Get in those medicine cabinets, honey. Just
Let me go
saying.
to the
Oh,
bathroom. Can I use your bathroom real quick?
Right. Exactly. You got to know. You got
Oh my
wow.
god, I
What,
never do
okay, so
that.
what medications are we looking for now?
Oh, there's so many. There's
You can
Victoria.
Google this. This question is on Google.
Oh, okay.
There
So
are top three.
So I listed a few. I
just
listed a
start
few
just start
on
taking pictures of the drugs and then
right.
go research them.
Literally, it's so true. But there's
Right.
so many different drugs. But it's so
But
important to know.
what do you do though with the drugs that can be taken for so many
Mhm.
different things?
As far as
I
what
don't
do
know
you
because I feel like let's say I don't a drug that everybody's talking about now is
Mhm.
Ozempic or something, right?
Oh yeah,
For
yeah.
diabetes, right? But now
Right,
people are taking it for weight loss. What if
right,
you have one of those drugs that's for something very simple, not STI related at all, but
right.
they also use it for STIs? Like, are
I
there
would
any drugs out there like that?
I would
Not to my
absolutely
knowledge. No,
yeah.
I'm gonna
But
answer that straightforward.
regardless,
No.
yeah, I would still ask because I mean I've known people to take Viagra, but because they have pulmonary hypertension, you know what I'm saying? Not because they have a penis. It's been women that I've known that've taken Viagra, but so
Really?
in a situation like that, I would honestly just ask. You know what I mean? I would ask, and like you said before, if you get tested, then you'll know for sure. I like to
True.
ask and know, but yeah,
So
Now I'm gonna start
these
I need
asking.
it
tests
all.
these tests are good the day that you get them.
So when you get tested, it usually takes about 2 to 3 days to get the results.
Okay, so
There are some rapid tests though. So
There
for
are some,
Yes.
HIV,
yeah. For
you can do a
HIV,
rapid check. It's
yeah,
not definitive, right? So
right.
if it
Hmm.
comes up negative, it doesn't mean that it's a true negative because you
Right.
might be not in the window of that test pulling up the HIV virus and seeing that it's an HIV virus. There is a test out there called the Alere test. It's the one that's more dominant and it's more than likely to give you the right answer. It's called Alere, but you can't normally get it yourself. It has to be
Right.
got. You have to get it from like a clinic or somewhere.
Right.
so the testing, so you get tested today and you
Mhm.
said about what, 2 to 3 days you get results?
For
Mhm.
Yeah.
blood work. For
So
blood work.
for blood work,
Blood.
right?
What
Specifically
else
blood.
is it? What you have to have urine tests as well?
Yes.
If you're going to be
Mhm.
testing for gonorrhea, chlamydia, or we forgot
Chlamydia.
trichomoniasis, so gonorrhea, chlamydia, trick, it'll
Mhm.
be from a urine sample. It could be from oral swab. It could be from rectal swab, depending on what you're using.
Right.
Okay, so if you get tested, if you go to the clinic and you get the works,
Hmm.
so they take blood and urine,
Yep.
and you get what, like 3 days. So that test is based on your status of health the moment that was drawn, right?
Right.
So if the next day you're with someone, that test is void. Is
Well,
that
Correct.
true?
right. The test
Correct.
is valid, but of course, you got to wait until you get the results.
Right,
But
but
it
I'm
is
saying the
void
test is only valid from the
for
moment
that
that
day.
that liquid was drawn. The
Right.
very next day you're with someone,
Right.
that test will be swayed.
Pretty much. Yep.
Right.
Hmm.
Got it.
Hmm.
So is the testing, like, how effective is testing if people are still doing stuff in between testing?
I feel like just like Dr. Travis said, don't do it.
Exactly. Give yourself to the Lord.
But if you see someone like me, I'm going to give you the education to say, hey, we're testing today. You must have a concern. Let's hold out a little bit. If you can back these folks up off of you for a little bit, let's see what your test results say before you go forward to do anything else. Because most of the time you come see me, you may have a concern already. And so let's put that on pause just for a little while. A little while. You'll be back in a minute.
It won't take that long.
Right. And that's when they proceed to hound us and call every single day until the results pop up.
Gotcha.
Yeah.
And are people testing at your clinic, or do they do like the online home tests and stuff? Like, what's the best case scenario?
I like people to do whatever is convenient to them. So if they want to do online home testing, there is an option for that in my services. There's also an option of having you go into a lab center and having the lab work done for you. There's also an option for us to concierge and send someone out to you to do your lab work for you at your home office, at your home or in your office, depending on where you are. We just won't do it in the street. We got to be in a place. So there's many options for you to get tested. If not me, then you can just Google sexual health clinics. You can Google Department of Health. I don't mind where you get tested. If you want to see me, that's great too.
Nice.
All right. So now that we've talked about all those infections and diseases and all that, tell us what is out there as far as prevention outside of a condom and stuff like that. What is out there in form of prevention for each one of those things?
Just don't do it. What you mean?
That's going to be your answer to everything. Oh, how about those folks that choose to do it?
Born again virgin.
Oh, okay. So back to the other side that choose. There is, for HIV purposes, there is medication that you can take orally every day for the purpose of stopping HIV. It's called PrEP, or pre-exposure prophylactics. And it's a medication you take to stop HIV. When it comes to, a lot of people are, if anyone's knowledgeable on this category, there is a medication out there called doxypep, and more data is coming out about what it can do to help people to reduce their likelihood of symptoms. But again, it is, you had sex and then you take this medication. It's not a preventative medication, if you will. And the medication can prevent.
A plan B.
It's like a plan B. Here you go. And you can take it up to 3 days after having sex, and it reduces, maybe, I'm going to throw a quick maybe up there, maybe the likelihood of chlamydia, maybe the likelihood of syphilis, and maybe the likelihood of gonorrhea. But you take it after you've been exposed, not before.
Okay, because you know what? I know somebody who works in the healthcare field, and one time she was attacked by a patient to where, there was blood and everything. So they gave her something to take. I didn't know what it was. I don't even think the person was truly aware of what it was. She just said that they gave her something in case that person was infected with HIV. So that would have been that
would be PEP. So after post-exposure prevention is that medication called PEP. And that regimen is a little bit different. It is 2 tablets that you're going to be taking for 28 days to stop the likelihood of HIV being able to attach itself to your body.
Wow.
But so you have a window. The window is only 3 days. Again, we're back to 3 days. 3 days, and the data support that if you can get this medication in you after the exposure up to 3 days, it has a 90, I believe it's like 97% likelihood of stopping HIV from happening when you go on the medication.
So
and how much is it?
Doxy something?
That's a different doxypep is for what I was talking about there was about for sexually transmitted infection. And then for your question, how much is it? It's expensive. It's going to cost you your soul, your body. No, I'm joking. Most of the time, most healthcare
clinics, an arm and a leg. Got you.
Most of the time, most healthcare clinics, if not the Department of Health, can get it to you for free.
Okay, that's good.
So free $99.
Free
Wow.
99. So
If you have
and
health
most
insurance,
of
they
these
will pick
things
up there.
most of these treatments are covered through most people's insurance, yes?
Yes, with
And
proper
if they're
Right.
documentation.
uninsured,
If you're uninsured, the prices I'm looking up online is like $600 to $1,000. If you want to do self pay, some people actually do self pay though, but insurance usually covers it.
okay. Mm.
So basically, your recommendation for people who are sexually active, if they're afraid to
Mhm.
be exposed or catch HIV, would be to get on PrEP.
Immediately. You might as well go ahead if you are sexually active. And I'll give you even more so. If you're sexually active and you have more than one sex partner, if you want to give it a quantified number, more
Mhm.
than one in a week. So more two or more partners in the same week, or in a month, four or more partners in the same month. It's probably time for you to really start thinking, should I go on some type of prevention for HIV? And all people, women, men, everybody can get PrEP if you wish to be on it and you're HIV negative. We can get you on PrEP to keep you HIV negative so you can explore your sexual behaviors however you want and not worry about HIV.
Okay. So how about the other stuff? Do they have prevention for the other STIs?
Oh no, my dear, those you will get.
Do
They
you
are
do
up
Wow.
for
that,
Welcome to the
grabs.
people?
jungle.
I tell
Wow.
so crazy is that when I prescribe PrEP to someone, my first thing I say out of my mouth is that this, for clarification, this medication is only to stop the likelihood of HIV, gonorrhea, chlamydia, syphilis, hepatitis B, hepatitis C, syphilis, trichomoniasis, and so forth. You can get any of these at any given time. So I wish you wellness.
Okay.
Serious.
Mhm.
And then you said insurance covers all of these treatments. Does it cover PrEP?
It will cover, most insurance will cover PrEP now, especially in New York State. I'm in New York State. I don't know where this podcast lands, but in New York State, it will cover. Most insurances have been coached into covering medication for HIV prevention.
Right.
If not, there are other ways where the actual servicing person or the pharmacy that, not the pharmacy, the, help me, Masanya, uh,
The prior
the
authorization.
pharmaceutical company
Mhm.
who owns the medication has a way for patients to
Oh, the
get
discount
an
program.
application to get at least 1 year of the medication for free.
Right.
Oh,
Mhm.
that's good. That's pretty good.
Yeah.
That's good to know.
We have a comment here. Terrace says, within any discussion about healthcare for African Americans, it's always important to talk about racial bias in diagnoses and treatment and talk and taking our healthcare into our own hands.
Mhm.
That's very good. That I agree.
Yep.
Yeah.
I agree. Any other last remarks or late, that can round up our conversation about healthy sexual practices and multiple partners?
Absolutely. Don't do it. No, I'm joking. I'm joking. It's going to be the slogan tonight, right? Don't
Right.
I
do
think
It
that
really is.
people
Do it.
It
might
really
start
is.
listening.
I
if
think I like that.
They might
if
start
you
listening to you.
if you are having any type of sex, any at all,
Mhm.
with a monogamous person in a marriage, with a gentleman, with a woman, with two men, two women, a cat, a squirrel, doesn't matter. Go ahead and get tested. It is the best thing you can do. And when I say tested, not just focusing on HIV, there
Right.
is gonorrhea of the mouth, of the rectal, of the urine. There is chlamydia of the mouth, of the rectal, of the urine. There
Mhm.
is syphilis that you can get in the mouth if you're doing that business. And so I ask that you not only focus on HIV, but focus on all the STDs and STIs. Speak to someone, a healthcare profession, go to a clinic, get tested. It doesn't matter. I just want you to get tested. And if you can't get tested, then what? Don't do it.
Don't do
Don't do it.
it.
I totally agree. If you
Mhm.
don't want to, if you can't, don't do it.
Right.
Awesome. Well, thank you so much. I thought this was really informative and scary at the same time.
Be very afraid.
Then I did my job. I did my job.
Yeah,
Exactly.
Yes, come through.
Well,
really
I
informative.
think you have instilled some fear into the people of the audience, or at least I hope so, because we do have a lot of irresponsible people out there. Because I
Right.
see so many stories online
Oh yeah.
Especially it's usually women's stories. I have yet to see a guy come on social media and all that stuff online to cry about how this person gave them this, gave them that. So we have a lot of irresponsible people out there, and I'm talking about the person who also got the thing as well, because again, we don't take steps towards protecting ourselves. We're just looking for somebody to blame when the misfortune happens. So we
Mhm.
need to do better. We need to be more vigilant. Like Masanya said, we need to ask questions, go in those medicine cabinets.
Yeah.
That's her advice.
That's my advice.
Go
Stay
in the
safe.
medicine cabinet, ask a million questions, get tested, and take charge of your own health. Because when you're losing weight, it's you. You take charge of it. You make sure you eat well, you exercise, you sleep, and doing all that stuff. It's the same for your sexual health. Make sure that you are vetting the person you're with, getting tested, staying on top of it, go in the medicine cabinet, and ask a million questions.
Mhm.
And to add to that,
Absolutely.
if you want to do any type of sexual activity, and perfectly fine, you just gotta maybe think about using a condom. Then again, if that person seems sketchy, you can have fun with that sketchy person with a condom, though, because now I
Yeah,
know I think that you're too sketchy for me. I can't let you get a hold of my body like that.
Right.
right.
Mhm.
No
Mhm.
red flags.
That part. That part. Well,
Anika
thank you so
said,
much.
be very afraid. Yes.
Yeah. Well, thank you guys. This has been really awesome. I really appreciate all this information.
We
Absolutely.
thank you for taking the time, Masanya, again and again and again.
Of
Thank
course.
you, Travis. We finally were able to get a hold of you. So
Yes,
thank
he's
you
so
for
Do you
busy.
have
coming through.
do you have like a website or something that people can
Uh,
find you, whatever, online maybe?
Absolutely, it's www dot hello shc.com, stands for simplehealthcare.com. Hello
Hello,
shc.com.
shc.com.
We're
Okay.
also on Instagram, Facebook. If you just look up Simple Healthcare, you'll find
Uh-huh.
us on Instagram, Facebook, TikTok, and LinkedIn.
Okay. Got it.
Thank you. We're gonna
And
post.
what about you, Masanya?
Well, I am on Instagram. As I said before, I am at the Divine Comfy Couch, spelled exactly like how it sounds. The Divine Comfy Couch. And
On
the best
IG?
way to find me on Instagram. On Facebook, I'm Krystle Mason. KrystleMason.
K-R-Y
Mhm. Yeah. O-N.
KRYSTLEMASON.
And
Easy way.
go ahead, Travis.
Oh, easy way to find us, and if you wanted to order an at-home test, would be on TikTok, and our TikTok is hello shc.
Okay.
Oh, sorry, underscore hello shc.
Or hello SHC, and that is to order
If you want to
the at-home kits.
at-home kits, or even go to our web page is there too. It'll bring you to our web page.
Okay, got it. Awesome.
Lots of good information tonight.
Always a pleasure. I'm
Thank you
so
again.
grateful. You guys
Thank you
stay
guys
safe.
for tuning in. Yes.
Mhm.
Thank you to our audience for tuning into the Poly Pimps podcast. Remember to follow us on Instagram, like us on Facebook, subscribe on YouTube, and we are everywhere. Keep sharing the information with your friends and family. Go watch after the live, since a lot of you are busy or afraid to watch live. But
Afraid.
That's
make sure
hilarious.
you give us a like and a share to make us go viral, because we're sharing great information. The more we
Yes,
can get, the more information we can bring to you. So
Mhm.
thank you. You guys
absolutely.
have a great night.
All righty. Thank
Good night.
you.
Good
Peace,
night.
y'all.
Peace, y'all. Have a great night, everyone.
You too.
Alrighty.